agus the Bronarm Professor Cusack and 20May26 show. I just want to ask you as well about just what you've just been speaking about, and if you could elaborate further, maybe. I'm trying to understand the interlock system myself, just from listening to you there. So is this? You know, are you saying that this should be brought in if someone has been convicted of a drunk driving offence or drink driving offence, or are you thinking that it should be coming into all cars? Because I'd imagine for that situation would need the motor industry would need to be heavy, and would have to be heavily involved in it. EU regulation would have to come from the EU. I'm just wondering, in other countries, maybe, is it someone that's been that has a conviction of drunk driving offence, or is there evidence, I suppose? Have you evidence around that people are repeat offenders of such offences, please?
The answer is it's phased. At the moment, it has to be voluntary because there's no legislation to support it. The next phase would be to target those drivers who are repeat offenders and or have very high levels that they have a problem. And then the third phase, and I would recommend it, is that all cars in the future be fitted with this, because if across Europe and across the world 30% of crashes have as a contributory factor alcohol, and you could stop that overnight with these devices, why not do that? So ultimately, and again, I try to think of bringing people with us rather than punishment or conviction, and say, this is actually safer for you, your passengers, your family, your kids, your livelihood. It'll save you in all of those phases. So I think we put it forward as a positive message. And when you think about it, I mean, what is so transformative or spectacular about saying you shouldn't be behind the wheel of a car if you're intoxicated with alcohol? So I don't think there's anything revolutionary in that.
Yeah, no,
well, maybe there is.
And I'm just wondering, in other countries, has the situation, the examples that you gave in other countries, is this along the same lines, that it's voluntary first and it is specifically targeted people that have offences of drink driving offences, or has it gone any further than that?
No, not yet. And I think that's the discussion that is going to have to be had. But quite a number of countries in the EU already have it in place, but it is within the criminal justice system, not on a widespread.
Okay.
And you're absolutely right. In fact, the Medical Bureau of Road Safety hosted the European review, the annual review this year, out in our premises in University College Dublin, to look at this. And one of the main outcomes of this was we have to continue to have buy-in from the car manufacturers, because clearly,
and I can imagine there'd be pushback if there's any extra cost to them. I can imagine the level of pushback that there might be.
Putting it in initially is not a huge extra cost, and that's why I go, if we look at our own cars, there is already so much in them. It's not a big deal, but we do need, and I have been told, and I must be careful when I say, that perhaps there's been a slowdown in the input from the motor manufacturers. Why, I don't know, because it makes their cars safer. In fact, it should be a selling point for their cars.
Yeah, I can imagine it's very tricky to like you said, that there could be lots of ways around it. It's something that there's a lot to be explored, to talk about, I suppose, within this. And would it include drug testing as well, or is it just alcohol?
No, at the moment, because it's a breath
in other
test,
countries,
and at the moment we can only measure drugs in blood or urine or oral fluid, saliva in the mouth. I've seen prototypes where, in fact, cannabis is now being looked at for measuring in breath. And since cannabis is the commonest drug in driving and indeed in society, followed by cocaine, that in itself will be progression. But at the moment, these devices are limited to breath testing for alcohol.
And just on that, about the 3-hour rule as well, like that you said in your opening statement as well about the 3-hour rule and how, I suppose, from a medical perspective, how well do you think this works?
Well, I think it's a very good debate, and this tattered book I have in front of me, I think, is one of the few copies of the Davitt report from 1963. My predecessor, who was actually my professor of forensic medicine when I was a medical student, at page 57 of the report, it actually set out why they chose the 3-hour limit, because I said, why was this chosen? For example, in the UK and in other countries, there is no time limit. And I know Dr. Owen Fogarty from Cork, I think, who's addressed this committee, he and I have spoken about the Australian experience, and they have no time limit. So it was actually put in, and if I may just take a moment, it said, the period must be sufficiently long to enable the suspect to be detected, the Gardaí to arrive on the scene, bring the suspect to the station and call the doctor to arrive, carry out a clinical examination and prepare for the taking of a sample. That was written in 1963, and it's as true today as it was then. But there is no reason why it has to be 3 hours. There is a physiological, I don't want to give a medical lecture on the absorption, plateauing and excretion of alcohol, but alcohol is absorbed from the gut, reaches a plateau and is excreted at particular times. Again, I will say the majority of people that we find are way over the limit. I think this is worth exploring, and I don't want to put in negative caveats, but there are considerations. And the first question I would ask is, how many drivers are we missing because of the 3-hour rule? It may be different. It's certainly very different because of distance in Australia. It may be different because of Cork and Kerry and the large distances. So I've spoken informally with the Gardaí and I've asked them, could they look into, maybe the next time at the committee, I don't want to set them up for a question, but do their members find that the 3-hour limit is a serious problem? There is a problem getting doctors now. We have a problem actually for doctors in general practice generally in the health. I'm sure the health committee next door is probably discussing that. But we have to look at that. There are also issues, and I don't want to put them in as negative ones, that a medical doctor who is treating a patient, I would have concerns as a doctor and having taught in medical ethics, that the same doctor who comes along to treat you, you're in pain, you've broken bones, is also going to be the doctor taking a sample at the same time for something that could be criminal evidence. I just think we have to work that out very carefully, that the treating doctor or nurse is not going to be involved in gathering criminal evidence. And I think Dr. Fogarty and I have discussed this. And also the issue of consent. There are cases before the higher courts at the moment, and one of them is also about custody of the sample. Who will take it? Where is it put? Is the hospital responsible? The Gardaí responsible? And I want to say I've spoken with Dr. Fogarty, and I think all of these questions can be answered, but I think we need to look at them. And also my fear would be that it would then lead to a prolongation of the period when drivers will actually have the sample taken, and that has implications for drugs. Some of the drugs, particularly cocaine and heroin, have a very short half-life. They don't stay in the blood very long. So if there was then a tendency to say we don't need to take the sample for 5, 6, 7 or more hours, we could end up losing some of that information. So there is a lot to be balanced, but I think it is very worthwhile exploring. And I would support Dr. Fogarty and colleagues. I also think some of my medical colleagues would have the same concerns that would need to be worked out. Like the unconscious driver, I drew up the guidelines when a sample was to be taken from a driver who wasn't able to give consent for the blood sample for possible drink driving or drug driving to be taken. And we went through all of this, the medical ethics, and indeed the constitutional issues. So there's a lot of debate, but it is a debate that we should have if there is a significant problem there. But with those caveats, if I may.
Thank you.
Margaret.